Good afternoon, everybody. I'm Roy Cooper, honored to serve as Governor of North Carolina, as your governor. And it's just wonderful to have with us today families, teachers, other educators, students, to talk about this change that we're facing. I know that a lot of families have been at home for a while and that schedules have been turned upside down and that family life is a lot different than it used to be. But you're here today because you want to try to make the best of it, and I do too. First, let me say that we are working around the clock to protect North Carolina, to save lives. We're working hard to slow the spread of this virus. Since nobody's immune to it and since we don't have vaccinations, we know that the way to slow the spread is for people to stay at home and for us to maintain our distance from each other and not gather in crowds, not go to school. Those kinds of things are designed to protect us, and we're grateful for that, for people who are willing to abide by that. Also want you to know that not only are we working to keep people safe and to slow the spread of the virus, we're working hard to make sure that people have the proper medical care if they do get sick. And we're fighting for supplies. We've gotten hospital beds and ICU beds available, and we're going to continue to do that work. One of the most important things that North Carolina does is to provide education for our students. And because of this coronavirus, we have had to close schools until May the 15th, something that I really hated to do, but we had to do it in the interest of public health and safety. But I am so proud of families, students, and educators who are working to make the best of these times. Grateful for the teachers who are conducting remote learnings and remote lessons and webinars and check-ins with families. Truly grateful that we're trying to make the best of this time. I know there are a lot of resources out there for moms and dads at home. Many of you have become home school teachers, and that's not something many of you plan to do, but trying to make sure that young people keep up with their schoolwork and their lessons is truly important during this period of time, and I'm grateful for that. Also grateful for all of our school employees like teachers and teacher assistants, cafeteria workers, and bus drivers. It's been really important how we have pulled together to make sure students got meals during this period of time. A lot of students depend on schools to get these meals. And just last week, for example, we served 2.8 million meals out there. So hats off to everybody who's working so hard and trying to make the best of this situation. I want you to know, too, that we're working hard to make sure that we cushion North Carolina as much as we can from the economic blow that has occurred from this pandemic and from the efforts to try to keep us safe. I work to enter an executive order that makes it easier and more accessible to get unemployment benefits. We've gone from an average of about 3,000 a week to 300,000 over the last couple of weeks. And the Employment Security Commission is working very hard to answer those applications. I know that some of you may have lost your job, and I know that you may have tried to apply for unemployment and you're having a hard time getting through the call center or online. Please know that they're working very hard to add additional servers, to add additional call center employees, because every one of those unemployment applications is critically important. We know that people need money to try to make ends meet. They're working very hard to make that happen, and if you haven't been able to be successful yet, I urge you to keep trying. In addition, I issued an executive order yesterday saying that utilities cannot cut off power to people in the next 60 days. Today's April 1st, and a lot of bills are coming due, and some families just simply don't have the money because of this pandemic. This order can help prevent the cutoff from happening so that people will still have electricity, so that they'll still have gas and water to wash their hands. Remember those simple things to keep people safe from the virus: washing our hands for 20 seconds with warm water and soap, making sure that you stand apart from each other. When you have to cough or sneeze, make sure you do it into the elbow. Let's don't shake hands anymore. I know that's hard because often we're used to hugging each other and that physical affection that we have for each other. I know my daughter came home from school a couple of weeks ago and I couldn't hug her like I usually do. But it's important for us to do those kinds of things. The order that I entered helps preserve that power and those utilities for people. We've also urged banks not to charge late fees and penalties, and we've urged the telecommunications companies to not cut off people's internet and phones for non-payment right now because we know that times are tough. And we're going to continue to work to cushion the economic blow and to help small businesses and to make sure our economy is going as well as it can under the circumstances. Thank you for recognizing how important education is and that it can never stop, even in the midst of a pandemic. You're going to hear from some great people who've got some wonderful ideas. I'm proud of our Office of Public Engagement that's headed up by Jeremy Collins. You'll hear from him and from Caroline Farmer and Ben Money and other people who are going to tell you about some things that are going on here. Remember, you can go to DHHS, NCDHHS, it stands for North Carolina Department of Health and Human Services, NCDHHS/coronavirus. It's NCDHHS.GOV/coronavirus for a lot of information about things that you can do to protect yourself and your family. God bless every one of you. Thank you for being with us today. Continue to work to stay safe and try to help each other out. If we all do our part, particularly talking to the students out there, if we all do our part, we will get through this well and healthy and happy. And on the other end, we can be even better than we were before. Thank you so much, and keep working hard. Stay safe.
Thank you, Governor Cooper. Thank you all for being with us today. My name is Jeremy Collins. As the governor said, I direct the Governor's Office of Public Engagement, and thank you all out there, whether you're joining us via YouTube or WebEx or some other social media stream. Thank you for being here for this, our third weekly webcast, where we try to give you as much information as we can to keep your community healthy and safe. Today, we are focused on students, teachers, and families. And as the governor said a moment ago, he's working hard every day to try to enact policies and share information that can put us out ahead of this thing. If you got this message from us yesterday, we said this pandemic is not going anywhere anytime soon. And so it's incumbent upon us to stay as healthy and informed as we possibly can. Today, you're going to hear first from Mr. Ben Money from the Department of Health and Human Services, followed by Ms. Caroline Farmer from our North Carolina Commission on Volunteerism and Community Service. Following that, you hear two community voices, Mr. GREEAR, who's a freshman at the University of North Carolina at Chapel Hill, and then you're going to hear from Ms. NASHONDA Bender-Cook, who is a Wake County educator, parent, and a vice chair of the Governor's Teacher Advisory Committee. After that, I'll come back and answer some questions that have been posed from online and give you some more insight. But I am glad that everyone is here to receive the information. I'll ask us to take in the information, give us your questions, but keep in contact with us. I'll give you this website again, but the governor's website is governor.nc.gov. There's a portal there that you can share your information with us, share your ideas, and also give us feedback on what type of information you want to hear more of. That website again is governor.nc.gov. With that said, I'll now invite up Mr. Ben Money from the North Carolina Department of Health and Human Service.
Thank you, Jeremy, and thank you, Governor Cooper. Just to give you all a brief update of where we are with COVID-19 in North Carolina. As of today, there are 1,584 cases in 79 counties, with a reported 204 individuals who are hospitalized, and unfortunately with 9 fatalities. I want to give you 5 things to know and to do during this period. First is hygiene and social distancing. It's really important for all of us to heed Governor Cooper's orders to shelter in place and to stay home. Social distancing really is our best weapon to fight this virus. It's a time-tested strategy for slowing the spread of an infection. Remember that COVID-19 is a new virus and it's highly contagious. At this point, we don't have a vaccine. And what we're trying to do is really limit the number of people that get sick at one time so we don't overrun the healthcare system and hospitals with very sick people all at once. We want to make sure that we have the hospital beds, the equipment, the supplies, and most importantly, the personnel to meet the needs. If we can flatten the curve, and I'm sure you've heard a lot about flattening the curve in the media lately, if we can flatten that curve, we can better manage the care of the very sick and save more lives. Remember what social distancing is. It means maintaining a minimum distance of 6 feet. And also remember with proper hygiene, that means, as the governor said, to cover your mouth and nose when you cough or sneeze, to frequently wash your hands, ideally with soap and water. If you don't have soap and water, to use a hand sanitizer, and do that for at least 20 seconds. Really important that we practice social distancing and proper hygiene. Second thing is to stay informed. Don't get caught up with a lot of scams and hoaxes, internet fraud schemes, and misinformation that's out there. It can be easy to get overwhelmed with this tremendous change that's occurring in our lives caused by COVID-19, but it's important that we sort through the flood of information and misinformation on this virus and get to the facts. At DHHS, we're continuously adding additional data to the COVID-19 dashboard as well as our overall website. As the governor mentioned, that's NCDHHS.GOV/coronavirus. We just added some new information specific to counties, including age and gender of cases and deaths, as well as some information on the details of how we're actually doing the reporting. We've also added information about hospital inpatient bed availability, as well as what our strategies are around outbreak surveillance. So particularly for students and students that are looking at careers in healthcare and medicine and public health, this is an unprecedented time, and this is really an opportunity for you to take advantage of the resources that are available on our website, on the Centers for Disease Control's website, as well as other states, to follow this pandemic as it progresses around the world and look at the strategies that we're taking to defeat it. So one of the things to know also is what the symptoms are of COVID-19, and to make sure that you and your family have a plan for what to do if one of you happens to get sick. So the symptoms of COVID-19 are fever, cough, shortness of breath, and these symptoms can appear for 2 to 14 days after the exposure. So one of the things I like to caution people about looking at some of the county numbers is, and I even had a relative that lives in one of the rural counties in North Carolina asked me over the weekend, said, well, I look at a map and I don't see anything in my county. Is it okay for me to go out? No, remember, this testing really shows what happened, in days prior. So we do have community transmission in North Carolina, and it's pretty safe to assume that wherever you go in North Carolina, you need to acknowledge the fact that the virus is present across the state. So, as I said before, heed Governor Cooper's executive order, shelter in place, and stay at home. This isn't a time to go out on vacation. This isn't a time to receive people coming from other states on vacation. This is not a vacation. This is a shelter in place in a pandemic situation, and we need to make sure that we're acting accordingly. So if you are feeling sick, if you have these symptoms, don't just show up at the emergency room if you're not in distress. And don't show up at your doctor's office. Be sure to call in advance first. Also, don't call 911 unless you have a distress situation. Household members and people who have been in close contact with someone who've had symptoms of COVID-19 should, of course, stay home as much as possible for at least 14 days. and monitor themselves for symptoms. Close contact means within, as I said before, 6 feet for at least 10 minutes. If a person starts having symptoms of COVID-19, they should take steps to prevent spreading it. Coronaviruses like COVID-19 are most often spread through the air by coughing or sneezing, through close personal contact, including touching and shaking of hands. That's why we've kind of gone to elbow bumps these days, or through touching your nose, mouth, or eyes before washing your hands. North Carolina Department of Health and Human Services recommends that persons who are experiencing fever and cough should stay home and not go out until the symptoms have completely resolved. Number 4, practice good self-care and patience. Be sure to exercise and eat healthy, and as much as possible, try to check out of the 24 news cycle and read a book, meditate, or phone a friend. And be mindful that this is also a time when addictions and other harmful behaviors can resurface. So find ways to manage your stress. There's also help available over the phone and through telehealth. Be sure also to follow your doctor's advice and keep taking your medications as prescribed. Be sure to limit your alcohol intake, and if you're smoking or vaping, this is an ideal time to stop. There are also resources available. Many medical and behavioral health practices are actually offering telehealth visits, often on the same day. We also want to make sure that you recognize that this is going to take time, and it's important to be patient. We all, of course, want to get back to our normal lives, but recognize the fact that social distancing, as I said before, is our greatest weapon. So let's practice that social distancing and keep us all safe. Finally, number 5, lend a hand. Of course, lend a hand with appropriate social distancing. So be familiar with the resources that are available, not only for yourselves, but also to help others. And be sure to take the time during your days to connect people in need. Ask yourself every morning, who can I call today and offer assistance? If you're internet savvy, perhaps you can help an elderly neighbor over the phone to navigate and find resources. Or perhaps you can shop for your friends or neighbors who are at high risk. And remember, those who are high risk are individuals that are over 65 or have chronic disease, chronic lung disease, severe asthma, heart disease with complications, or who are immunocompromised. Of course, people of any age or with severe obesity or underlying medical conditions, particularly if they're not well controlled, such as individuals with diabetes, are considered to be at high risk. Today is the first day of the month, and it's important to recognize that many folks will be receiving benefits today, and they'll be going out shopping. So be mindful of this as you go shopping. Shop for what you need. There's really no reason or need to hoard. Also, recognize the fact that during this unprecedented time, it does create opportunities for us to adopt new healthy lifestyles and new practices. Many folks have found new hobbies, new interests, new ways of being able to give back and volunteer. And it's really important, considering that this is a time when we do have challenges as well as opportunities, to look to those that can give us some resources around how we can serve others within our community. And with that, I'd like to call up Carolyn Farmer, who's the Governor's Director of Volunteer Services, to give us some of those ideas. Carolyn?
Thank you, Ben. I really appreciate the opportunity to get to be here to speak to everybody. Right before we get started in this event, we were talking about what a long month March has been. It's really been a long 2020, which just makes me think about how important it is to make it meaningful, in addition to keeping in the know, as Ben said, make sure you're informed, as well as helping out your neighbor. So along those lines, for those people or those entities that are involved in their private nonprofit that might be eligible for public assistance because they're doing some of the emergency protective measures, there is currently, FEMA is now taking applications for public assistance grants. Now, you have to do a few things first. You have to watch a applicant briefing. It's a 2-hour briefing. It started this week. It's Tuesday, Wednesday, Thursday this week, Tuesday, Wednesday, Thursday next week, 10 to 2 or 2 to 4. The information is on the Volunteerism.GOV website, and you'll be able to follow the links to the locations for those briefings. So that's the first thing, is you have to see a briefing before you can register. Second thing is to register at the phone number and email address that was up on the screen just a minute ago, the PA hotline at NCEM.org. So register is the second thing, and the third thing is then you get to apply for the grant. So the information is up on the screen right now. Just make sure you call or email once you've gone through a training to make sure that you can go through the process of registering and becoming an applicant. Now, resources for students and families. You know, you've heard me talk about the need for volunteering for feeding, but there's a couple of good things I want to make sure that you have. I can't assume that you know this already. I know the governor's been announcing about the texting to find out about student feeding. No Kid Hungry. They are tracking where the feeding sites are for students. So I want to make sure you know that, you have the site, and you are able to check it frequently. In addition, DHHS also announced that they are increasing the benefits for family who receive food and nutrition services, FNS. So I want to make sure people know that the financial benefit has gone up for families who receive these benefits. In addition to that, DPI just announced yesterday an initiative to try to get restaurants involved and engaged in feeding students. So if you know someone involved in the restaurant industry that might be able to assist in this way, there is a training on Friday at 10:30. So this is for across the state. It's for the summer meals program. Friday at 10:30, the information is on Volunteerism.GOV, the website that is for the Commission on Volunteerism. So I encourage you to pass that information along. Education. Now, this is not my area, but I do want to make sure you know about resources that are available, since we're talking about students and teachers and families. DPI has remote learning resources available. This is also on the Volunteerism.GOV website. And then UNC-TV has started hosting curriculum-based shows during the day. And for 4th and 8th graders, it is from 8 a.m. to 1 p.m. From 9th to 12th grade, the curriculum shows are from 1 to 6 p.m. I'm going to repeat that. 4th to 8th grade is from 8 a.m. to 1 p.m. 9th to 12th grade is 1 p.m. to 6 p.m., and this is UNC-TV. So I want to make sure that even those of you who have limited access, if you have access to UNC television, public television, there are resources for our continued learning, because this is going to end. And we need our students to be educated. We want them to be thriving in the future. And so we want to make sure that they have those resources available to them. Now, resources to help. You know, for the Commission on Volunteerism, this is our bread and butter. We want to make sure that you know that you can help. And last week we hosted a training, and it's on the website as well, where we had all the different organizations that we knew were out and involved and engaged in this service to ask public health all the questions they were worried about. And so we did that. And I thought one of the interesting comments was, you're probably safer volunteering at a food bank that is taking all the precautions to make sure that you're safe than you are going to the grocery store. So if you're able to go to the grocery store, you are able to volunteer and help your neighbor, whether that's delivering meals, whether that's delivering groceries, whether it's running errands, or whether it's packing food at a food bank. Not everybody is in this position. So we need you to encourage others that are healthy and not at risk to step up in this way. State employees, we're encouraging you by giving, for those of select unessential positions, we're encouraging you to get more community service by helping out with COVID-related activities, such as the food banks. And then there's a new program that launched yesterday. It's called CORONACommunity.org. CORONACommunity.org. And what this does is it allows you to help elderly, those at risk, those who can't leave their homes, register with their needs locally. They can find out, they can get help with meals, food, pet supplies, pharmacy needs, medical needs, as well as a well check. Because, as I mentioned in the past weeks, this is having an effect on a lot of people. And if you are isolated and you're at home and you're alone and you do not have someone who can run errands for you and do these things, then you are most likely in need of somebody who's checking on you and having a nice conversation about what's going on in the world, in their world. So I encourage you to get involved. Have your church group, your community group, join at coronacommunity.org. For those of you who have been involved in hurricane response before, you'll recognize it as Crisis Cleanup. It's the same organization. And what you do is you get approved by the organization, and then you will go in and on the backside and get to see the people in your community who need help. And if you're able to meet the help that they are requesting, you adopt them. And then you take care of those needs for that individual. You go and find someone who can do the help. So these are the resources that we have right now that we are trying to make sure are making North Carolina a better place to live during this time. I'm proud of all the stories we hear. I'm just going to share this because he would never share it himself, but I'm sitting across, over 6 feet across from one of the guys from emergency management, and he just happens to mention that his spring break was canceled. Well, most of our spring breaks are canceled. And he said, well, I've decided to take the money that we would have spent on spring break, and I'm supporting 2 families with it that are unemployed. He's doing it anonymously. Now, I like that. He can't go to the food bank. He's working full-time in emergency management, but he's helping. He's taking something that would have been lovely for his family and making it lovely for several families. So please encourage others who are able and capable to support their neighbors, the food banks, the food pantries, the food delivery services, to do so as much as they can. And on behalf of Governor Cooper, thank you all very much for letting me be here.
Good afternoon, everyone. My name is GREEAR Webb, and I'm a first-year student from Raleigh, currently studying at the University of North Carolina at Chapel Hill. I'm also proud to be the co-founder of NC Town Hall, an organization focused on working with communities across our state to reduce acts of gun violence. I'm honored to be able to call in today and address leaders from across the state. I'd like to start by thanking the governor and other leaders, especially Secretary Cohen and our statewide education leaders who are directing our state during this difficult time. As I said, I'm a student at UNC Chapel Hill, and this is definitely not how I planned on finishing my freshman year. As students, although it's not super fun quarantining at home and missing out on experiences we may not have again at all educational levels, it's necessary in this moment to do whatever it takes to save lives. Right now, young people have the power to show that we are listening to medical experts and going through with the instructions of our government leaders. As it was mentioned during last week's call by the Reverend Lisa Yaboa, by staying at home, we are protecting others and engaging in an act of justice for others. We must do what we can to flatten the curve and mitigate the rates of community spread by washing our hands, staying home as much as possible to maintain that physical and social distancing, and by coughing and sneezing into our elbows. As students and people in general, we like to engage with others. However, as tough as it is, students specifically must not gather in groups at this time. To do so would be inconsiderate to those who may suffer from the unexpected spread. Again, hopefully by following the orders set in place by government leaders and health officials, our communities can get back to living in a sense of normalcy soon. If you need more information, go to the governor's website, which is governor.nc.gov, or the North Carolina Department of Health and Human Services website, NCDHHS.GOV, or the CDC website, cdc.gov, and other trusted sources for health information. As young people, we can navigate these sources to inform those around us. We all want our communities to be safe and healthy, and we all have a role to play in that. From the college perspective, we as students will continue to look and follow the directives of the university system as we look forward to continued communication from our resilient North Carolina college communities. Again, thank you to Governor Cooper, Jeremy, and state leaders, and thank you, fellow community and faith leaders. I also specifically thank any youth that are watching now or that plan to watch later. By working together and heeding the warnings of experts, we can all mitigate the spread of this virus. Let's listen and then act. Do it together, as we know North Carolinians can do. Thank you, and continue to be vigilant.
Hello, my name is NASHONDA COOKE, and I'm a teacher at Carroll Magnet Middle School here in Wake County. Every day at our school, our students practice building characteristics such as empathy and leadership as we focus on community-based problem solving. This current situation is an opportunity to put those skills into play. I'm also the parent of two amazing students who receive a stellar education in Wake County Public Schools. The corona crisis has affected my life as it has yours, personally as well as professionally. Family members have fallen fatally ill. Others continue to work as essential employees. Activities such as play dates, going to the movies, and talking with my neighbors have been put on hold. Travel plans for spring break and even my daughter's volleyball tournaments have been canceled. My youngest daughter lives with autism. She needs structure. We try to provide that as much as possible. As an educator, I haven't seen or hugged my students in over 2 weeks. The last collaborative conversation I had with my coworkers was virtually. This is a new way of life for the time being. This will also undoubtedly change the face of education. It's an awesome burden to put our lives on hold, but nothing is more encouraging to do just that than to make sure our loved ones are healthy and safe. I applaud and appreciate Governor Cooper as he continues to be the great leader North Carolina can depend on. He continues to collaborate with stakeholders and agencies as our State Teachers Association and others in order to be proactive and address necessities of our state with a persistent and strong determination. While we endure this trial together, I encourage you all, students, educators, and parents. Students, you will see your friends again. You will also see the educators who care so deeply about you. In the meantime, stay focused. That's what your teachers meant when they said, I won't always be around to help you make the right decision. Right now, that decision is to continue your education by doing the activities that the educators are planning and trying to deliver. Teachers, you will be able to see those light bulb moments in person again. You are still doing the work. For now, let's continue to do what we do best and make sure our students are receiving the very best of us in the means we have to deliver that. You have the support of everyone, including your administrators, to help you navigate through this. And to the parents, take this time to be a direct part of your child's education. It won't always be easy, but remember, this is a unique life experience and a lesson for your kids you have to be a part of. You have a chance to be a part of that. I'm familiar with the challenges while working from home and helping my own children, but we can do this. Talk about what they've learned and show that you are willing to learn right along with them. you will see your child excel in a classroom again. Please be patient as we develop the best educational experiences for all of our students. At this time, we can all do one thing together. Appreciate this opportunity to be with our loved ones that we normally don't have time to be with. Discover why you are a family. And last but certainly not least, take care of yourself. Find moments to give thanks and to become stronger while remembering those who aren't so fortunate. Let's continue to be the strong village that we are, and we shall overcome this. Thank you.
Thank you, GREEAR and NASHONDA. Thank you to Caroline and Ben, and of course, thank you to Governor Cooper for this opportunity. I want to just kind of bring us back together around a few things and just kind of remind us where we are. In the face of this COVID crisis, we're still having to manage our lives and keep our families moving. I want to remind you that today is Census Day. So April 1st is Census Day. We have an NC Counts Coalition, and there are NC Counts committees that meet to make sure all of our communities are counted. So I know you're at home with a bunch of stuff to do, but make sure that you don't forget about census. That web address is my2020census.gov. So make sure our communities are counted in a safe way. Of course, we're always maintaining our social distances, but make sure that we don't forget today being Census Day. Next, one of the questions that we received a lot today is around both unemployment insurance and disaster employment assistance. Disaster unemployment assistance. I want to direct you all to our, this web address may not come up on the screen, but I want to direct you to our Department of Commerce. That's DHHS.NC.GOV. Now, some of you may have already been there. You might have been kicked out of the site. Maybe the system was overwhelmed. We know that this morning there was a very heavy, a lot of traffic on the system, but don't give up. Be persistent. That system is back up now, and we want to make sure you go to that site and file any unemployment insurance claims that you would need to, but also learn more about disaster unemployment assistance. We're in that place right now. We are putting on many web-based programs much like this one to make sure that you have the information that you need, and we'll post that on our site as well and send you the links to those to make sure that you can tune in to the right segment to get the assistance that you need. But for both unemployment insurance claim and disaster unemployment assistance claims, let's start at our Commerce page website, which is des.nc.gov. The next thing I've heard a lot about is the executive order. The governor filed or issued executive order 121 Friday of last week, which went into effect Monday at 5 o'clock. So we're just under 48 hours of that executive order being in place, that stay-at-home order. And folks have asked, what does it mean? We've also put out some frequently asked questions about it. But one of the things that I've heard quite often is, well, which one takes precedent? If I live in a county or a municipality and they have more stringent rules than the governor's or the state's stay-at-home, which one takes precedent? The answer is the one that's the most stringent, the one that has the tighter restriction rules. So if you live in a county or a municipality and they have a curfew or something that's not addressed either by our executive order or it's a tighter restriction, you have to follow the restriction that is in place by that municipality. You should also know that those restrictions, we are encouraging people to just follow them and suggesting that that's what's best for public health, but they do have the weight of law. They can be enforced by local law enforcement. They are a Class 2 misdemeanor. We hope that no one would continuously violate the executive orders, but what you must know is that these executive orders are in place for your health, for your safety, for the health and safety of your family, and for the health and safety of our North Carolina community. Again, one of the questions I've heard quite frequently is about churches gathering, faith communities gathering. What you should know is that Churches are still encouraged, faith communities are still encouraged to gather. If there's going to be a worship, less than 10 people, but faith communities are encouraged to have virtual worship experiences. Funerals, for funerals, 50 people or less. Weddings would take on the same restrictions as a worship service. And another question that's come up quite frequently, churches, if folks want to gather and stay in their cars and be at kind of the place of worship but not exit their cars for a worship, that is allowed. Please understand that there's a saying about this. Everything that is permissible is not necessarily beneficial. And I want you to remember that. Everything that's permissible is not necessarily beneficial. And so just understand that you are exposing yourself to this pandemic, and if you should choose to do so. We want to keep you healthy and safe. We know that your communities want to keep you healthy and safe. But each time we expose ourselves to crowds and other people, we are not only increasing the risk for ourselves, but we're increasing the risk for other people. If you have other questions about kind of any of the executive orders or our talking points, you can always visit our website, governor.nc.gov. Finally, I want to just remind you to be thoughtful and to be kind. We're in a space now that none of us are familiar with. We have to both bring our best selves to this moment and accept the best of others. So if you're a community member or a neighbor, I heard someone talk about this earlier, volunteering, we encourage it, but also one of the best forms of hospitality that you can show, one of the best forms of gratitude and affection that you can show is to be still. This pandemic isn't going anywhere, and we haven't seen the worst of the curve yet, and so we're all learning and figuring this thing out. And what we know that can slow this spread and can flatten this curve is for us to stay as still as possible. So be kind, be thoughtful. You may be able to go out and handle your business, and you may not feel sick, but just understand that you may interact with someone who either is sick or who is more susceptible to illness than you are. So I want you to remember that. Employers, remember that when you have a person on your staff who maybe is in the elderly range, the more susceptible range, we understand we want to make our profits, we want to have our productivity, but we're also in the middle of a public health pandemic. So I want us to be thoughtful about that. Our office wants you to be thoughtful about that. We understand that we've left it up to many employers as to work hours and how to manage those things, but our people are our greatest assets. Our people are our greatest assets, and we have to take care of each other. And so we're asking you to be good neighbors, to be good friends, to be good community members, to be good employers, to be good stewards of each other. And what that means is we're going to be in this together. We're going to do our best to give you as much information as we can. We want to hear from you. Again, our website is governor.nc.gov. Talk back to us. Tell us what information you want to know. And we plan to be right back here next week to share as much information with you as we can. And if we can do anything to help you, please share that on our website. Give us the information, and we'll get it to you as quickly as we possibly can. So on behalf of Governor Cooper, the administration, the Department of Health and Human Service, our guests who are here with us today, our Department of Volunteerism and Community Service, thank you for being here, and God bless you all.